Every single time you use the bathroom, your body is giving you a health report. The color of your urine, ranging from completely clear to dark brown, and every shade in between, contains specific, medically meaningful information about your hydration, kidney function, diet, medications, and in some cases, the presence of serious disease. Today I'm going to teach you how to read that report. My name is Dr. James Whitaker. I'm a board-certified urologist, and today I want to talk about something that your body shows you multiple times every single day, and that most people never pay attention to: the color of your urine. Because your urine is, in a very real sense, a window into your body's internal chemistry, and learning to read what it's telling you is one of the simplest, most cost-effective health monitoring tools available to you, requiring absolutely no technology, no doctor's visit, and no expense. Let me walk you through the complete spectrum of urine colors, what each one means, and which ones should prompt you to take immediate action. Let's begin at one end of the spectrum: completely colorless, clear urine. When your urine is absolutely clear, resembling plain water, this typically indicates one of two things. The first is simple overhydration. You've consumed so much water that your kidneys are excreting it rapidly and have diluted the urine to the point where no pigment is detectable. This is generally harmless and self-correcting. It can happen after drinking very large amounts of water in a short period, after consuming alcohol, which suppresses antidiuretic hormone and causes your kidneys to produce more urine, or after certain medications including diuretics. The second possibility, when urine is consistently clear across multiple bathroom visits, is a condition called diabetes insipidus, not to be confused with diabetes mellitus, the blood sugar condition. Diabetes insipidus is caused by either insufficient production of antidiuretic hormone or the kidney's inability to respond to it, resulting in consistently high volume, very dilute urine. If you notice that your urine is consistently crystal clear and you are urinating in unusually large volumes despite not drinking excessively, this is worth discussing with your doctor. Moving along the spectrum, pale yellow urine is the ideal. This is what optimally hydrated urine looks like. The pale yellow color comes from a compound called urochrome, which is a byproduct of the normal breakdown of hemoglobin, the oxygen-carrying protein in red blood cells. When you are well hydrated, urochrome is diluted to a pale straw color. This is what I want your urine to look like for the majority of your bathroom visits throughout the day. Slightly darker yellow, a golden yellow or amber color, indicates mild dehydration. Your body is conserving water and your kidneys are concentrating the urine, producing a higher concentration of urochrome. This is the normal color for first morning urine, which is expected to be darker after 7 or 8 hours of fasting and no fluid intake. But if your urine is this color throughout the day, you need to drink more water. The fix is simple and immediate. Before I continue, I want to ask you to subscribe to this channel if you haven't already. I am Dr. James Whitaker, and I release detailed medical content every week that is designed to help you understand your own body better. Hit subscribe and drop a comment below. What color is your urine most often? I'm genuinely curious, and your comments help me understand what topics to prioritize. Dark amber or honey-colored urine indicates significant dehydration. Your kidneys are concentrating urine substantially because they are not receiving adequate fluid to work with. This color should be a clear prompt to drink water immediately. Now we move into colors that carry more specific medical implications. Orange or dark orange urine. This is a color that can be alarming but is frequently explained by benign causes. Certain foods can produce orange urine, particularly large amounts of carrots or carrot juice, which contain beta-carotene, and beets to a lesser extent. More commonly, certain medications produce orange urine. Rifampicin, an antibiotic used for tuberculosis, is a classic example. Phenazopyridine, a urinary tract pain reliever available over the counter and often prescribed alongside antibiotics for UTIs, produces vivid orange urine and is completely harmless when taking that medication. However, orange urine that is not explained by food or medication can sometimes indicate liver or bile duct problems because bilirubin, the pigment excreted by the liver, can color urine orange to yellow-brown when elevated. If you have dark orange urine without an obvious dietary or medication explanation, and particularly if it is accompanied by yellowing of the skin or eyes, contact your doctor today. Pink or red urine. This is the color I want to spend the most time on because it is the one that requires the most urgent response. Pink, red, or rust-colored urine almost always indicates the presence of blood. The medical term is hematuria. I devoted an entire previous video to this topic, and if you haven't watched it, please do, because blood in the urine in a man over 50 must be evaluated by a urologist urgently. I want to be very specific. Even a small amount of blood can color a large volume of urine pink or red. The amount of blood required to visibly change urine color is less than 1 milliliter in 500 milliliters of urine. So what looks like dramatically red urine may actually contain a relatively small absolute amount of blood. But that does not make it less important to investigate. Brown or cola-colored urine. Dark brown urine can have several causes. Severe dehydration can produce brown urine as the kidneys concentrate waste products to extreme levels. Certain medications, including metronidazole and some laxatives, can produce brown urine. Rhabdomyolysis, the breakdown of muscle tissue following extreme exercise, crush injury, or in some medical conditions, produces brown or red-brown urine due to myoglobin, the oxygen-storing protein in muscle, being released into the bloodstream and filtered into the urine. This is a serious condition that requires immediate medical attention. Brown urine that appears after starting a new medication should be reported to your prescribing physician. Brown urine with no medication or exercise explanation should be evaluated promptly. Cloudy or turbid urine deserves its own mention. Urine that is murky, cloudy, or turbid rather than clear generally indicates either the presence of white blood cells, suggesting a urinary tract infection, or the presence of phosphate crystals, which can form in alkaline urine and are generally harmless. If cloudy urine is accompanied by burning urination, urgency, frequency, or odor, assume it is a UTI and contact your doctor. UTIs should not be allowed to progress untreated, particularly in men, where they can ascend to the kidneys and cause serious infection. Foamy or bubbly urine. Occasionally urinating forcefully can produce temporary foam in the toilet bowl, which is completely normal and disappears within seconds. However, persistently foamy urine, foam that remains in the bowl for 30 seconds or more, can indicate the presence of protein in the urine, a condition called proteinuria. Protein should not normally pass through the kidney's filtration system in significant quantities. Let me give you the practical takeaway from everything I've shared. Your target is consistently pale yellow urine throughout the day. Dark yellow means drink more water. Red or pink means call your doctor today. Orange or brown without a clear explanation means call your doctor this week. Persistently foamy means ask your doctor for a urinalysis. Cloudy with symptoms means call for a UTI evaluation. Your urine is a free, always available health diagnostic tool. Start paying attention to it. I am Dr. James Whitaker. Subscribe to this channel for more content like this. Share this video. Urine color is something everyone should understand, and almost no one is taught. I'll see you in the next video.